Greetings. My name is Dr. Caroline Guerrero-Calqui, and I am the chair of the Fellowship Committee for the International Academy of Orthokeratology. The purpose of this PowerPoint video is to help you prepare for the written test that you're about to take. And what I want to do is give you the benefit of a lot of our experience in how we also prepared ourselves. And so let me just take this opportunity to go with you step by step on all these different slides so we can focus on what you need to do to prepare, and that way you'll be best prepared to take this test and you will pass. As you can see, this test is broken into three parts: a multiple choice, a short answer, and some slides. Now, the multiple choice is somewhere between 50 and 60 multiple choice questions, and the reason I'm ambiguous about this is because we're constantly changing the test based on new information that's come up in terms of orthokeratology, corneal reshaping, and also based on your feedback. If everybody's missing a particular question, then obviously it's not written properly, and so we will remove that and replace it. Also, if you're ever taking a multiple choice test here and you don't agree with any of the answers or it's confusing, we'll turn the page over and write on the back and tell us what your concerns are, because you may then demonstrate you have a greater knowledge than would ever be tested with a multiple choice question, and it's just that you're not getting what we're trying to extract from you. So just tell us verbally on the paper what the problems are, and then we will, even if you chose the wrong answer, if you show us you know what you're talking about, we will give you credit for that particular question. You'll also have a chance to answer short essay type questions, 2 or 3 paragraphs on a particular topic, and this is also an alternate to multiple choice. If a person really has a lot of trouble with multiple choice questions, you can show us what you know in a different format. And then finally, of course, we'll be showing you slides, and those slides might be a fluorescein pattern, they might be a topography map, and we'll have some multiple choice questions or possibly some essay questions, but it just depends on the format, so that you can also demonstrate your knowledge based on looking at actual outcomes. This particular slide shows you the different topics that we're going to be covering, and you're going to be expected to know them all. And the most important part is that in this next coming slides, we'll go through this in detail to tell you specifically what we want you to know in each of these topics. This particular slide shows you the different topics that we're going to be covering, and you're going to be expected to know them all. And the most important part is that in this next coming slides, we'll go through this in detail to tell you specifically what we want you to know in each of these topics. In pre-treatment, we want you to have good grasp of what the contraindications are for fitting Ortho-K, both absolute and relative. And if you feel like an absolute contraindication is still okay for you to fit, that's fine. Just be able to justify it, and then also make sure you are able to describe to us what you would do to inform the patient of this off-label type fitting, and know what is an off-label type fitting for Ortho-K. In the U.S., of course, we have the FDA, and so have a good sense of what the FDA parameters are for fitting Ortho-K. And in other countries, you may have something similar to that, and you may receive some questions on that, so have a grasp of that. And then finally, of course, candidates. What are excellent candidates, questionable candidates, and candidates that anyone should avoid? Continuing on with candidates, we want you to have a good grasp of patients who are challenging to the fit, such as the ones we've had listed right here on this particular slide. And it doesn't mean these people can't be fit, it's just that we want you to be able to recognize that they are a challenge and how you might prepare the patient or deal with the patient during the fitting process. And again, when you have a patient who's a current RGP wearer or a previous Ortho-K wearer, what do you do about that? How do you prepare the patient? How do you approach the whole fitting situation? How does eccentricity relate to this whole fitting process? What do you do with those data prior to designing your lens. And then, of course, astigmatism. Can you recognize the different types of astigmatism and how they might need to be dealt with differently when designing a lens? You've got your older patients. They're sometimes treated a little differently than your younger patients. So know the special challenges that an older patient might provide. And then, of course, there might be a question or two on informed consent contracts. And so have a good sense of what a well-designed contract should look like. Topography. You need to be able to analyze a topographic map and extract the data from that in terms of how that patient is appropriate for candidacy or not. What's a good map? What's a bad map? But all of these issues in terms of topography are very, very important for determining candidacy, so have a good sense of analyzing a map for pretreatment. And then, of course, you need to know all about the topographic maps because they're super important to this exam. All the different types that are there, when you would use them, what map you might choose, axial, tangential, subtractive, for the different situations, and that's just not for pretreatment, that's of course for the outcomes as well. Know all of the information that the topographic maps might be able to provide for you. And of course there are some alternatives to topography, such as keratometry and placido disc, and these are not super important to orthokeratology, but as a fellow you should be able to have the information about those two particular topics, even though they won't be discussed extensively. So now, after we have determined candidacy, we begin to design our lens. And as you know, there are many, many ways to fit Ortho-K lenses. Of course, there's the empirical, there's the trial fitting method, there are custom designed lens programs for you, there's a combination program, and it doesn't really matter what type you choose. What does matter is that you have to know how to fit this lens and how to design a lens. Now, if you happen to just do empirical or trial fitting, you've got to be able to know a whole lot about the curves. But more importantly, you have to know designs in general. So you're going to have a grasp of what is a 3, 4, and 5 reverse geometry lens, double reverse geometry. What are the benefits of additional curves? Even though you may not choose to use that kind of software, you have to know it because fellows have to have a breadth of knowledge in terms of how they design and fit lenses. You've got to know the function of the various parameters. Now you see the big sign on this, top priority, very important. That's because if you don't know this stuff, you aren't going to pass the written test and you'll never go on for the mentor-led. So get an absolutely firm grasp on all these different curves and parameters of the lens that I list here on this particular slide, and know how you manipulate each of them, and when you do that, why you do it in terms of troubleshooting, and how you might do that to get a lens to fit better initially, and how much do you need to change it in order to actually affect the change that you want in terms of microns and such, millimeters. You've got to really have a grasp of this, even though you may not order a lens in that way. If you don't know how to manipulate a lens, you're not going to pass the fellowship exam. So you've got to concentrate on this. This part is super, super, super important. Now, this particular slide here talks about other things that we might ask. These won't be a giant part of the test, but as you can see, Munderland's formula, eccentricity, prolate versus oblates, you've got to have a good broad sense, and so these might be a part of. Now, this particular slide here talks about other things that we might ask. These won't be a giant part of the test, but as you can see, Munderland's formula, eccentricity, prolate versus oblates, you've got to have a good broad sense, and so these might be a part of the test, so do have a sense of what each of these particular topics means to you and to fitting. Now we're going to ask you how Ortho-K treatment is achieved. And as I think we all know, this is a little bit on the controversial side, but there are plenty of data to help us know how it's happening, even though it might be controversial. And so it would make good sense for you to know all the different prevailing theories and the studies that support how the effect is achieved. So have a broad sense of what this is, because this might be on the test. Of course, what Ortho-K test would be valuable without a large portion of it being devoted to myopia control. So what you've got to know is the prevailing theory on why Ortho-K does control myopia, the studies that support it, and the mechanism of action. You also need to know the different methods alternative to Ortho-K that are used to control myopia as well. The soft lenses, the behavioral aspect, pharmaceutical, have a good sense of that. But most importantly, you need to know how you would alter the design of your particular Ortho-K lens to control myopia specifically. And we all know that a standard Ortho-K lens is not by definition, a myopia control lens, and so you've got to be able to take a design, make a modification, and show us you know what those modifications are in order to do a good job at controlling myopia. In terms of designing your lens, we also want you to have a sense of what role eccentricity plays in your design. And then, of course, to the end, case-controlled studies supporting Ortho-K, because there are a lot of different studies, and we might ask you about a particular study. And you don't have to know the study from top to bottom, but you do have to have a sense of the studies, at least the names, because your patients are going to ask you for data at some point, and we don't want you to say, oh, I don't know. You should know, of course, yes, it's this and this and this and this, and have a sense of it and where to find it. Now we come to the outcomes section, troubleshooting and complications. See the sign up there, high priority, super high priority. So what's going to happen is we may give you a map, or we may describe a map, and this map may have a variety of different problems, or it may have a single problem. You have to identify the problem, and then most importantly, you got to figure out how is the best way to solve that. You will also be given fluorescein maps with the same outcome. You've got to figure out what the problem is based on the fluorescein map and how you would change that lens design. And I don't mean just a brief description of how to change it. You really need to know what to do, whether it's increase a diameter by 0.2 of a millimeter or whatever. You have to describe exactly what you would plan to do to change and modify and improve that fit. To call out a few specific complications, decentration. It's one of the most common and one that we will be concentrating on, and so be able to identify it. Tell us how much is acceptable on a decentration and under what circumstances, and again, specifically how to fix it. We talk also about a loss of treatment. Now, whether that's insufficient treatment in the initial fitting of the lens or after several months, get a good sense of what causes those things and exactly how you're going to fix that. Do you know what too much sag looks like? Do you know what effect it has on the fit? You better know, because that is also going to be on the test, so know it cold. There are other outcomes that happen from an Ortho-K fit, and you can see them right here: dimple veiling, iron deposits. They aren't big deals, but know what they are, know what they look like, and what are the causes, and what do you do about them, if anything. Finally, we come to the problems of corneal staining, keratitis, and the red eye. While these, again, are not very common in Ortho-K, you need to be able to recognize them in terms of what they look like and what causes them, and again, how do you fix that? Lens care and follow-up. Again, know what the recommended solutions are for your particular section, and the cleaning protocol. Cleaning protocol is pretty universal. The solutions are sometimes a little bit differently. We won't be asking you for brand names, but certainly categories. What is the best way to put the lens in? Take it out? What's the follow-up that's most important for your patient in terms of, is it 1 day, 1 week, 1 month? Give us a good sense that you know how to follow your patients very, very safely. And then if there is a problem that's occurring either with the fitting, the design, or a physical, pathological complication, when do you pull the plug and say, hey, let's not wear this lens for a while, and how long do you think they should be out? Now, we're getting to the end of this PowerPoint presentation. What I want to do is show you here, what are your resources? What can you use to prepare for this? Well, you should be attending the Advanced Ortho-K seminar, but that will be given the morning before you take the test. And so by the time you attend this seminar, you should know everything in detail. The seminar is like the dessert. It helps you pull everything together. You can ask questions there, but it's really designed to expand your knowledge rather than give you the knowledge. And it's extremely useful. This is an amazing seminar, and so you'll be required to attend it, but if you don't, you're really going to be sad, because it's a very, very good one, and it's given as a part of your fellowship journey. Now, we will provide you with an e-version of Montfort. He has given us his permission to provide it to you because there isn't a new Montfort book. Now, some of the topics in this book are outdated, but it's still a good reference book because a lot of the stuff is not outdated. And so as part of your preparation, we'll send this to you, give you a link on a Dropbox so you can download it and have your own electronic version. There's also a nice book that I've listed here by Pauline Cho et al. And it has some very nice pictures you can get your hands on. It's colored. It's not very expensive. I know you can get it from the American Academy website, and you probably can get it from Pauline Cho directly. It's a great nice reference for studying. Of course, there's the IAO forum postings that post all sorts of interesting questions, and if you just don't really get a topic, put a question out there to the group, and I'm sure someone will answer, because everybody's very nice about participating. And, don't be embarrassed about feeling stupid if you post a question. I mean, everybody's been in that position before, so, post away if you need some questions. And, of course, questions answered. And then the Internet is a great place to throw up a question, because it'll usually have about 5 or 6 different answers on it, and maybe some of them aren't correct, maybe they are. It's your job to look through it and say, that doesn't sound right, or didn't even think about it in that way. That's great. Sometimes there are some really nice pictures posted online. Some of our speakers have actually posted their PowerPoint presentations online, and so you'll be able to rummage through the Internet using Google or whatever you wish and get a lot of your questions answered. And of course, you can always send an email to your fellowship chair, or if you have a mentor. Sometimes you'll have a mentor. Sometimes we don't give mentors until after the particular exam is completed and you've passed it, because a mentor really has to spend a lot of time, and it really isn't the mentor's job to prepare you for the written test, because that really takes a lot of self-study. So, in summary, you can see here there's no elevator to success. You have to take the stairs. But this particular journey of preparation will really make you a better fitter, a better orthokeratologist, and you'll feel great about yourself because you'll have so much more knowledge, and you'll be prepared to take the test and pass the test with flying colors. So, here you go. Start preparing.